Hey, this is Dr. Brock. This is for all the people that are about to do an interview for the emergency response teams around the universities or at the University of Windsor. And this is a quick running through the scenario to be able to help you be able to put everything together and what you need to think about as you're going through it. Most likely, they'll tell you that you need to respond to someone with an injury, and they're going to have a checklist someone will be checking off to make sure you run through all the different steps. All right, so this is for all those people that are just about to interview. Watch this over and over again until you're able to get the whole response together. I want you to be able to repeat this word for word and step by step. So the first step, we're going through emergency scene management, right? So in your scenario, they're going to say someone has a cut on their hand. They need you to go and respond to them. A person's having a seizure. They need you to go and respond to them. So the specific treatment is just one check mark, right? But the whole response is hitting all the check marks, right? So if you don't know the specific treatment for a specific condition, that's just one check mark, basically. But if you know how to do the whole response, then the whole response is really what they're looking for. So here we go. Let me run it top to bottom, and you'll remember we did this in the class, but I want you to be able to hit all these certain things. So the first step is to walk in and survey the scene, so the scene is safe. So you walk in and you say this: there are no hazards here, the scene is safe. Mechanism of injury is unknown. Casualties is 1. Assistance, I'll need campus police and ambulance. And I have on my gloves, goggles, and mask. I'm going to introduce myself. Hi, my name is Brock. I'm with the campus response team. I'm here to help you. What's going on? So that right there, that was MCAP, EMCAP. Environment, Mechanism, Casualties, Assistance, and Protection. So let me run that one more time. So I walk in, the environment is safe, mechanism of injury is unknown, casualties is 1, assistance, I'll need campus police and ambulance, and I have on my gloves, goggles, and mask. Introduce myself. Hi, my name is Brock. I'm with the campus response team. I'm here to help you. What's going on? So they tell you, oh, I cut my hand. Oh, I have a chest pain. They tell you what's going on. So we can say, all right, let me update campus police. So you get on the radio, update campus police of the situation, what's going on, and that we need an ambulance called to the scene. All right, so then you think primary survey, the airway. So I want you to say A, B, C, D. So I want you to actually do the A, B, C, D. So airway, breathing, circulation, and deadly bleeding. So out loud, you're going to say, the airway is open because they're speaking to me. They are breathing, and their heart is beating. They're circulating blood, and there's no deadly bleeding. So if you see deadly bleeding, right away take care of the deadly bleeding and start bandaging them up right there. Open up your trauma bag, grab your dressing, grab your bandage, your roll of gauze, and start bandaging them up right there. All right, so for primary survey, I want you to say their airway is open, they are breathing, and they have good circulation, and there's no deadly bleeding. So that's the primary. So then you want to move into some kind of specific treatment if you know the treatment, and then we're going to do our secondary survey. So secondary survey is history, vitals, and head to toe. All right, history, vitals, head to toe. So you're going to start with history. So you're going to ask them all the sample history questions. So you'll say, so it's okay if I ask you some questions? So tell me about your chest pain. And then they'll tell you about it. Okay, on a scale of 1 to 10, 10 being the worst pain that you ever felt you can imagine, how much is this right now? And they'll say 8. Okay, can you point to where it's located? Right there. If you can describe what it feels like, what would you say it feels like? They would say it's a crushing pain. So then you can recap. Okay, so it's a crushing pain right in your center of the chest, and it's an 8 out of 10. Does anything make it worse? Does anything make it better? When did it start? When it first came on, did it start as an 8 or did it start lower or higher? Okay, so it started at a 3. It started how long ago? 10 minutes ago. And over those 10 minutes, it's gone from a 3 to an 8. Okay, so you have a good understanding. So the location, when it came on, when it comes on, how long does it last for? Does it move anywhere? Is anything else associated with the pain? Does anything relieve the pain? Does anything make it worse? The intensity, what it feels like, the character. So you're finding all that information. All that's under S. So then you're going to move through the acronym. Do you have any allergies? Do you take any medications? Have you taken any medication for this problem so far? Okay. Have you been diagnosed with any medical problems? When did you eat or drink last? And what were you doing right before the problem happened? So now from there you can make some decisions. If they say that I have chest pain, then consider their medication. If they're having allergic reaction, consider their EpiPen now and give them their EpiPen. All right. Before you give any medication or you want to give them their medication, you always want to confirm the 5 rights of a medication. So that's important to know. But let's keep moving through the acronym. Okay, so you just did history. Now let's move on to vitals. So thank you for sharing the information with me. I'm going to measure some vital signs now. So you're going to move into taking the 5 vital signs that we can measure just without any equipment. So you're going to measure their pulse and their breathing. So you're going to hold on to their radial pulse. You're going to put your hand on their shoulder. All right, so for the first 15 seconds, you're going to get the pulse. So let's start my stopwatch right now. So I'm feeling the radial pulse for 15 seconds. And then the number you get, you're going to multiply by 4. So let's say it was 20 beats. All right, so 20 times 4 is 80. So it's 80 beats per minute, strong and regular. So make sure you don't just say the rate, but get the qualities. If you hit all those qualities, they're going to be like, wow, this guy is amazing. So you want 80 beats per minute, strong and regular. Now focus on the breathing while you're still holding on to the pulse. Okay, so we're going to trick them so we get their breathing rate. So let's say you get 4, so 4 times 4 is 16, so 16 breaths per minute, regular and full. Okay, so then you're communicating this out loud so the person who's assessing you can hear. So you're actually saying, so 80 beats per minute, strong and regular, 16 breaths per minute, regular and full. So you're touching the skin, so you consider their skin color, condition, and temperature. So the color, condition, temperature, so their skin is warm, pink, and sweaty, or warm, pink, and dry. All right, grab your flashlight, so pull out your cell phone or find a pen light in your bag, and so you're going to look to see, so say the pupils are equal, so you're looking at the pupils and showing the flashlight in, and they respond to light. So that's the box in the center, so pupils equal and responsive to light, and their level of consciousness is alert. Then grab your blood pressure cuff, since you have more advanced equipment, so we'll put on the blood pressure cuff and we'll get a blood pressure. Okay, so 120 over 80, and put on the pulse oximeter and say their O2 saturation, whatever it says, let's say their O2 saturation is 98%. Okay, so those are your good vital signs. You can get blood sugar if you want. Ask the assessor, do you want me to measure your blood sugar? And they'll probably tell you no. All right, but they know that you're thinking about it. They'll give you a point for that. Okay, so then that's history, that's vitals, and now I'll do a head to toe. So you can say, so is it okay if I just feel from head to toe, look and feel from head to toe to see if there's any other injuries? And they'll give you permission. So you have on your gloves, so you're going to feel around the head. So you can say things like, there's no pain, no swelling, no lumps, no bumps, no bruising. Feel down the back of the spine, come around to the neck, the eyes are there, the nose is there, the teeth and tongue are there. The trachea is in the midline of the body, no jugular vein distension. The collarbones are stable. Upper arm, lower arm, upper arm, lower arm. You can test grip strength, so take your fingers and put them in their hands. They'll squeeze your fingers, so you can say the grip strength are equal bilaterally, so they're equal on both sides. Then you can press in on the chest, put your hand on the abdomen, and if there's no pulsating mass, you can communicate no pulsatile mass, then you can feel the upper right, upper left, lower left, and lower right. Press in on the hip bones and test upper leg, lower leg, lower leg. Have them wiggle their toes. If everything's fine, roll them on their side, feel down their spine, both shoulder blades, and you're done. So that's history, vitals, and head to toe. Then you would consider their ongoing casualty care. So out loud, you would verbalize, I'm considering the ongoing casualty care. Sir, would you like me to call someone to let them know that you're going to go to the hospital or that you've been injured? Do you want me to call your parents? Do you want me to call a spouse or a family member? All right. You can say, do you need transport to, if they're not going to the hospital, do you need transport to your next class or anything like that? Maybe campus police can help arrange a ride for you. So we can send someone to wait for the ambulance, let them know that they're coming there. We can find their health card, find their medications. We can give their parents a call. We can put them in some type of position appropriate for their condition, so you can roll them on their side. So even if they're just going to sit, you would verbalize to the assessor their good recovery position for this situation would be with them just sitting and leaning forward so that it can help them breathe. Or I'm going to roll them on their side because they're unconscious. Or I'm going to have them lay on their back in a good recovery position in the supine position. And I'm going to cover them with a blanket. So you can consider treating for shock. So treating for shock, you can find the cause of shock. You can cover them with a blanket. You can rest and reassure them everything's going to be okay. You can put them in some type of position appropriate for their condition and then give oxygen. So if you haven't given oxygen already, if they're having difficulty breathing, then you can pull out the non-rebreather and put the tank up to 10 to 15 liters per minute and give them the non-rebreather mask and just stay with them until the paramedics get there. If you hit all those plus doing whatever specific treatment is for that specific condition, so you notice all of that had nothing to do with a specific condition. I didn't perform one specific treatment, but now I can consider, through that, did I bandage their hand as a specific treatment? Did I give them their medication as a specific treatment, like an EpiPen? Be aware of that scenario. That's an easy one, just to give them their EpiPen. So when you before you give any medication, you want to consider the 5 rights of a medication. So you want to consider that it's the right medication. So, sir, is this the medication you wanted me to get? Your EpiPen? Okay, and it's your medication, so I see your name written on the bottle. When is this the right time to take it? When you have this situation, allergic reaction from it, when you've been stung by a bee? Yes, okay. So it's the right person, it's the right medication, it's the right person's medication, it's the right time to give it. And now consider, okay, how much do I give you, and how do we put it in your body? Okay, so those are your 5 rights of medication. Then give them the medication to administer, or maybe ask for permission. So they have to be fully conscious and specifically request your help to assist in administering a medication. So fully conscious, specifically request your help, and then check the 5 rights of a medication. You've done that, you're going to pass the scenario no problem.